learned from the other four participants quite a lot because it's a bit tough to sort of outdo some of the things.
That, Subrat.
Absolutely. And I'm sure today you won't be disappointed. I'm sure you're going to learn a lot from my superpower panel that I've put together.
Right. But yeah, I mean, the first couple of months in quarantine meant that a lot of sort of mopping and cleaning and the splitting of responsibilities of household work was done between the spouse and me, which sort of gave you a fairly good picture of what people who come in and help you at your homes, what their lives are about, and how hard that work is. It's not easy, as I've realized. So yeah, I mean, dignity of labor is something that I always find is somewhat missing among us, including myself. A lot of us grow up with a lot of privileges and then continue to have those privileges. So it
And we
was a
take
good,
them so for granted as well, I
yeah.
think.
Mm.
I think
So yeah, so
that was
that
a
is
good
what I
learning.
learned.
Very nice, sir. Quickly, Sanjeev sir, can we move on to you before we start off?
Oh, when the stalwarts have spoken, I can only say that I learned to eat a lot less,
Eat a lot
fearing
less.
that, yeah, fearing that this quarantine will just result in some weight gain. So I've just made sure that I'm not gaining weight by eating a lot less.
I think I have to connect with you separately on that to understand how you're managing to do that. So I'm just getting a cue from my team that Mr. Bhatt will take another 5 minutes to join. But let's at least all of us are together, and I see the number of attendees increasing as well. So I think it's best for us to start off because everyone else is on time here. So just a quick note to all the attendees who are listening in to us on Zoom and to all the panelists as well that we are now live on Facebook, LinkedIn, Twitter, and Zoom. So a big welcome to each and everyone here who's watching us, who's listening into us. I'm sure you have a lot of expectations and there is a lot that you want to learn and understand about the pharma industry from the experts here. So just in the beginning of the session, I'd like to tell you that whatever thoughts, questions, comments you have during this conversation, please feel free to put in the chat box here in Zoom if you're listening into us on Zoom. If you're on Facebook, LinkedIn, or Twitter, please put in the comment section below. My team and I will be very happy to navigate through and we'll try to take up as many questions as possible. A quick note to all the panelists as well. People might keep posting their questions, and while I might be busy with one of the panelists, if you feel that you could answer to that person, you could just type out the answer for that person for that question. Please feel free to do that on the side as well. So without any further ado, another 2 minutes from Mr. Bhatt. But without any further ado, please allow me to welcome all of you to today's panel of Manipal ProLearn School of Pharma presents Pharma Virtual HR Leadership Conference powered by Observe Now. I have a very diverse set of panelists today who are going to be talking about emerging of skills and the need of skills in the pharma industry to make India the dominant player in this industry and the ways to bridge this skill gap. Of course, this comes in line with our PM's mission and vision of Make in India and Atmanirbhar Bharat. The idea today is to understand from these industry leaders, how do we go there? What are the challenges that we are facing to go there? How organizations like Manipal School of Pharma can actually come and play a big role in sort of bridging that gap. So the age-old debate of industry and academia, we've got it covered right here. Allow me to welcome the panelists for my session. We have Mr. Subrat Mohanty, who is the Group President of Manipal and Manipal Medical Group. Hi, Mr. Mohanty. Thank you for joining us. We have got Mr. Chandru Chawla, who is the Executive VP and Head of US Specialty for Respiratory, Board Member of Cipla Health for Cipla Limited. Hi, Mr. Chawla.
Hello.
We have Mr. Farhat Umar, who is the Senior Vice President, Group Head HR for Mankind Pharma. Hi, Mr. Farhat.
Hi, hello. Thank you.
We have Mr. Suresh Sugavanam. Can you correct that?
That's right, Suresh Sugavanam. Yeah.
Thank you. Thank you very much for correcting me over there. So, Mr. Suresh Sugavanam, who's the Vice President and MD of South Asia, Sub-Saharan Africa for UL. A big welcome to all of you. And we are yet to be joined by one of our other panelists, Mr. Ajay Bhatt, who seems to be having some technical difficulties at his end, which my team is managing. He is the President of Global HR for Aetas Pharma. As of now, we've got our panelists ready. So Sanjeev, I'm going to move on to you to please introduce yourself as well, and sort of set a context for the panel discussion.
Yeah, thank you, Tanya. Thank you so much for the introduction and the warm up to the session. So, ladies and gentlemen, this is Sanjeev Goel from Manipal ProLearn, and the reason that we are all gathered here today as part of the HR leaders from pharma industry for this virtual conference is to really discuss the possibilities that together between the pharma industry and Manipal that we can forge together in terms of addressing some of the upskilling initiatives and the skill gaps that are there currently in the pharma sector. Before we actually get around to doing that, let me take you through a very, very short presentation, and it is on your screen now.
Sanjeev, you'll have to share your screen.
Visible now?
No, you have to share your screen.
Just a minute.
So while Sanjeev is trying to fix that, I think I can see a lot of comments here already on the chat box. So once again, guys, feel free to put in your thoughts and your questions as well. It's a very good chance for all of you to get hand-to-hand answers from these industry experts. I'm sure they're very happy, and they have personally told me that they are very happy to contribute as much as they can in this panel. So please feel free to comment on whatever you like, or any questions that arises from this, any questions that you have particularly pertaining to pharma industry as well. So that would be also very welcome. And I can see Mr. Ajay Bhatt also trying to join in here. In the meantime, Sanjeev, are we okay there at the back end?
Yeah, can you see the screen now?
No, we can't. Can everyone else see the screen?
No.
No. You're the co-host. Just click on share screen.
Hi, can you hear me?
Yes. We can. We can.
Okay.
My apologies. I'm sorry. I got late.
It's all right, Mr. Ajay. We are just, Sanjeev is just setting the context for the session. And I've already done your introduction, but I'll get back to that once Sanjeev is done with his context setting and we actually start up with the discussion. Sanjeev, please,
Okay.
Go ahead.
Thank you. Thank you, Tanya. This short presentation is really going to give you a context about Manipal Global. As you know, the Manipal Group, which is the Manipal Education and Medical Group, has a very name suggests education and healthcare. On the education side, we of course run multiple universities. We also run the corporate training wing under the Manipal Global entity. On the assessment side, we have Meritrack, which pioneered online assessments 20 years back in India. On the healthcare side, of course, you have the chain of Manipal hospitals, Manipal clinics, and on the health insurance side is Manipal Cigna. Earlier, this was an entity known as TTK Cigna Health Insurance, which was taken over by the Manipal Group and rebranded as the Manipal Cigna Health Insurance. In terms of our university footprint, apart from the 3 universities that we run in India, we also have 6 international campuses around the globe, spread across Antigua in the Caribbean islands, Dubai in the Middle East, Nepal in South Asia, and Malaysia in Southeast Asia. At the bottom, you can scroll through some of the pictures of our campuses across the globe. We have close to 1 million alumni from the 9 universities that we run, 6 internationally and 3 in India. In terms of Manipal Global, which is really the entity that we fundamentally are going to focus on today, Manipal Global runs the BFSI Academy, which pioneered the banking sector-led training programs with the ICICI Manipal Academy, which was started around 14 years back. And post that, of course, we've tied up with almost close to 45 different banking partners, straddling both the public and private sector. And this academy runs both long-term programs, which result into a diploma, as well as an MBA, which is a 2-year MBA, and of course runs short duration programs as well. The Benitrack, as I said earlier, a 20-year-old organization. We've been the pioneer in multiple elements of assessments, not just the on-screen marking, which is used primarily by the universities and colleges, but in the post-COVID scenario where it's difficult for universities and colleges to take assessments in the campus. Our solutioning around remote proctoring through an AI-enabled tool, which allows students to take their examination sitting at home, has proven to be invaluable. And recently, we've had a lot of good work, done there, especially with the recent test concluded for Manipal Academy of Higher Education, Amrita University, and many others. On the corporate professional learning side, we have two brands, Manipal ProLearn and Jigsaw Academy. Jigsaw Academy focuses on the cutting edge technology led training, be it data analytics, cybersecurity, Internet of Things, IR 4.0. And Manipal ProLearn looks at some of the more traditional arms of training, including the Sales Academy and the Manipal School of Pharma, the Manipal ProLearn School of Pharma is also going to be under this brand. Similarly, we run a lot of leadership training programs and the programs around some of the frontline sales training programs, which are run with organizations like Britannia, Unibic, PNG, so on. So this is just to give you a bit of a context to why and how the Manipal ProLearn School of Pharma is being thought through. So because we have a gamut of programs which we are running in IT and in sales and on leadership and management skills, and of course a lot of the domain side, which could be IT, which could be BFSI, which could be sales, and we have the ability to deliver it through multiple means. So be it campus programs, online virtual classrooms, self-paced through our EduNext LMS platform. And it, of course, appeals to multiple levels, right at the final year students who are preparing for jobs, fresh graduates who are finishing schools, mid-career professionals for some of the RBT and role-based training programs that we conduct, and of course, the leadership and transformational programs that we run for senior professionals. So the reason and the thought behind now launching the Manipal ProLearn School of Pharma is really to look at creating a finishing school which trains graduates specifically for the pharma sector and more focused on the manufacturing side, because on the sales side we believe on the there is already some bit of higher supply meeting some of the muted demand right now for sales professionals in the pharma sector. But on the manufacturing side, there's a huge demand for people who are trained on QA, QC, quality management processes, and of course, the US FDA regulations. So this sector, of course, and looking at some of the data which has been shared by various pharma sector associations, this sector will need to hire close to 2 million employees over the next 5 years. And in terms of revenues, is slated to grow by almost to $100 billion by 2025. And there are, of course, we all know that there are close to 3,000 pharma companies, close to 10,500 registered drug manufacturing units, and close to another 20,000 unregistered or tin sheds, which really manufacture chemicals as inputs for some of the large pharma organizations. So before we get into the video on the Manipal ProLearn School of Pharma, just a quick bit in terms of the fact that when we launch the Manipal ProLearn School of Pharma, it is going to focus primarily around three different kinds of roles. One around QA/QC, which is on quality assurance and quality control chemists, one on machine operators, and the other, of course, around sales. I will now play a video.
Manipal Education and Medical Group is a global conglomerate with deep expertise in education and healthcare. Manipal Global Education Services, with its rich experience in conducting and delivering learning solutions, has a stellar track record in producing first day, first hour productive employees for the BFSI, IT, and consumer goods industries. We are now looking to transform the pharma industry by bringing transformative programs in sales, analytics, and manufacturing. Happy to have launched the Manipal ProLearn School of Pharma in collaboration with UL. UL is a global leader in pharma knowledge and the sole authorized training agency for the US FDA. We are now all set to enroll our first batch of learners. Our faculty comprises of industry professionals with strong practical knowledge. Together with UL, we aim to bridge the skill gap in the pharma industry.
I'm greatly excited to be here today at the launch of School of Pharma for Excellence in Quality. This school represents the coming together of two very strong, well-established brands. UL, which is synonymous with quality practices and certification throughout the world, especially in the pharma industry, and Manipal, which has built a huge legacy of providing quality education and training services in India.
We believe we've come together for a common cause. And the common cause is that of having a finishing school for the pharma and life sciences industry that we see as a significant need in the country India right now. And what we see as India is exporting more and more drugs and pharma, we believe that the manufacturing sector here really needs that talent of people who are well versed in everything from quality to production to manufacturing and engineering.
And a very key ingredient or an important element which contributes to this journey is the quality of people and how well trained they are within the Indian pharma industry.
What we will look for is taking graduates, take them through such schools so that they can actually end up in the top tier pharma companies in India, which are not just making in India, but actually making it for the rest of the world.
Our endeavor through this school is to come together and bring, world-class practices, world-class training material and content, which enables the workforce within Indian pharma industry to meet those standards. This program and programs of this kind will go a long way to improve the skill levels of Indian university graduates and enable them to get high-quality jobs in industries like pharmaceutical, which is a high-growth industry.
Over to you, Tanya, and I welcome on behalf of Manipal ProLearn all the panelists and of course all the members of the audience who have joined us. I will now switch off for the time being and over to all the panelists and Tanya, you.
Thank you, Sanjeev. Thank you for setting that context and making my work easier. And Mr. Bhatt, I think you can now come on video so that people can see you. Yes, there you are. And Sanjeev will be listening into the conversation. So just give me a second. Yes, all the technical things are sorted out. So thank you very much, Sanjeev, once again for setting the context. Now, enough has been said, and I think we all know where the direction the discussion is heading. So I need to understand from all of you here. The idea today to call all of you here and to have this discussion was obviously to understand if there is such a huge market for pharmaceutical industries in India, how are we going to tap into the market? How are we going to create the necessary talent? And how are we going to train the necessary talent to become the likes of a China or a United States of America? So I want to ask all of you. There's also a stat which says that the Indian pharma sector is worth 55 billion US dollars, and biotech will sort of touch 100 billion US dollars by 2025. So now I want to understand from an Indian standpoint, how can India brace itself for an upcoming scale battle like this? And how can we sort of conquer the pharma market? Where are we at present and where do we need to go? So I'm going to come into each and every one of you for a 3 to 4 minute opening statement on this. If you could start off with your introduction and the company that you represent, and then give your opening statements on this. So once again, I have Mr. Suresh on my screen first now. So sir, please you start off giving your context.
Okay, sure. Thank you, Tanya, and thank you to the rest of the panelists and also all the audience here. So as you requested, Tanya, maybe I'll start with a quick intro of UL first before I kind of give my opening sort of a short burst to address your question. As you probably saw in the video, UL is, well, we are a 125-year-old safety science company. We're headquartered in the US. And given the legacy of 125-year-old safety science, which is what we pride ourselves on, we are an independent third party. We do not make any product, but what we do is we set standards, we test and certify products for safety, security, and sustainability. We also inspect and audit and train the staff around the world. And given the heritage of 120 plus years now, obviously pretty much every country in the world, you can imagine, we either are present in or operate and so on. And as part of that, of our work, we actually do interact with several government and regulators around the world. And as part of that, I think as the video also called out, the US FDA relationship has been quite special for us because over 37,000 US FDA inspectors and auditors that inspect and audit facilities around the world are trained through the curriculum and program that we have set up in partnership, of course, with US FDA. And it's not just the US FDA. I think we have those or similar relationship and accreditation with the China FDA or the Saudi FDA or the UK MHRA and so on. So there are a variety of different regulators around the world with whom not just we've had the relationship, but also the accreditation, which kind of gives us the body of knowledge, which then now when we look at the Indian market, and in India, we've been here for about 20 years now. And I think when Manipal reached out to us, and thanks to Subrat, Sanjeev, and team, clearly we see the opportunity here as well in terms of just pulling the wealth of knowledge that exists already and ensuring how we can pull that in for specific to India, because as you called out as well, Tanya, I think India has already become quite a big powerhouse of pharma manufacturing and exports. And the question is, what does it take to take it from here to the next level, and what kinds of skill sets, what kind of training, curriculum, etc. would be needed? And that is where we believe we can bring a lot of value, and that is where this angle that we are coming in from. I think the specific point I'd address, and I'm happy to elaborate on this as an answer to your question, but I'll just give a short version. I think the big differentiator, if you may, as to the 50 odd billion to the 100 odd billion that we all aspire for, the big differentiator would be that of quality. And if we can consistently demonstrate quality, not just for the US FDA approved plants, but actually across the board, no matter where Indian drugs are exported, or even internal usage, I think there's a big difference between the quality of drugs which are sold here locally versus what we sell outside of India. So if we can focus on just one word, which is quality, and it's very deep rooted. I mean, I'm happy to go into what I mean by just saying the word quality, everything from R&D to manufacturing, formulation, the quality control.
And what might be the hindrance for good quality local drugs in India?
Well, a lot of that, again, I think a lot of that starts with the mindset. I think both on the supply side, where the companies are, but also from the demand side. I think a lot of times, and obviously all of us also get used to the whole chalega attitude, that whatever kind of gets you by, or appropriately take shortcuts. I mean, I remember, I mean, I'm sure all of us would remember when we were in the physics lab in 10th grade or 11th grade, when we were measuring something with a vernier caliper, we would be like, okay, 21.3 ka value hai, 3 reading lena hai, and so on. And then people would just make up the second and the third reading, and just, right, that is all kind of, it is so ingrained in us that we several times forget that there is a reason why the 3 readings were important. And we just kind of circumvented that and so on. So I think if we really go down deep into the psyche and how we conduct ourselves in our everyday life, I think this industry, I mean, so yes, there is a need for a curriculum, etc., but there's also, from a competency standpoint, there are a lot of things that we need to work on. And not just this industry, by the way, that point is a very broadish point for across the board. So I'm happy to elaborate a little further on that, because I'd obviously like to hear from other panelists as well. But I think to me, that one word differentiator is just quality. Focus on that one word.
Quality and also the mindset. Quality and mindset as well. And wouldn't you feel that getting high revenue from the exports that we do in pharma industry could also be the reason for low quality produce and sort of distribution in India?
Well, no, I wouldn't say it that way, Tanya, at all. In fact, I think eventually I'm a big believer in free market, and sort of you get what you pay for. And I think in several times in India, we always look to cut corners. I mean, a simple shirt that we buy, I mean, the amount of quality and rigor that this would have gone through, or a toy that we would have bought for a kid, would be very different. I mean, everything from the chemical analysis of the dyes used in it to even physical characteristics. There are lots and lots of quality related points that need to be assessed in pretty much every product we consume. I mean, whether it be toys or garments we wear, or to the smartphones we use. So I think it's all pervasive. So it's, to me, more of a mindset issue there.
Mindset and quality. I think the big pharma company leaders that we have here might be able to shed some more light here on this. But thank you for your thoughts, Mr. Suresh. Mr. Farhad, can I move on to you and have your thoughts and your opening statement, and anything you might want to say to what your previous fellow panelists have said, any addition or subtraction to that? Agreement or disagreement, whatever you might.
Okay, thank you so much, Tanya and the management of Manipal, for inviting us for this very important session. Mankind is a 26-year-old company, okay, started 26 years back. And now Mankind is in top 3 position, even in this tough situation of disruption. Mankind is showing great growth of 50% last quarter. And as Mr. Suresh was talking about the quality part and all, it is very, very important for pharmaceutical company. But at the same time, we have to think that when we are going to the next market or next level, I think it should be more affordable also with the quality. So that is the uniqueness of Mankind, that Mankind as a company is able to deliver the quality product, and as well as it is more affordable also, very economical also. But more thing is there that we are there in all areas, and if you see the growth of Mankind, we are going to all across the world, including the US also, and we are going to implement the same strategy in US also. So, as for the growth of Indian pharma industry, depend on the supply chain, and especially when this Corona is there, I think 70% API is delivered from China. This is a challenge for Indian pharma company, and we are having a complete, a very unique business model. Even dealing with the essential commodity, we have everything within our own manufacturing, including the packaging material and all this thing. That is a unique business model of Mankind. We have almost 20,000 people are working under the leadership of Mr. Rajiv Jadeja and Mr. Arjun Jadeja. And we have a very strong pipeline and very strong vision also. And the way we have given a direction to Indian pharma industry internationally, Mankind is a company which has been always there in all kind of discussion. So we as the company are looking out for more and more opportunity to expand our wings and deliver more quality products. And we are looking for talents also. One more important thing would like to tell that if you want to grow in pharma industry, I think we cannot grow without leadership and that strong talents. Talents are very, very important. I was very happy to see your video, especially. I was thinking that we can collaborate with you when I saw the video of your regarding this quality assurance, quality C, and then Suresh was talking. It is really encouraging to see that we can looking for this kind of opportunities and more opportunities for the new students, the coming students coming out from a good institute like Manipal, where I could see that the kind of syllabus and curriculum you have and the kind of backing you have with Suresh and team. I think it is very encouraging and good to see that Indian pharma industry going to take control all across the world. Even we have this disruption, but we have learned many things in disruption also. That a lot of opportunities are delivered, and still we are fully prepared to face these kind of challenges, and that is the uniqueness of mankind. So thank you.
Also, can you suggest what kind of collaborations you could have with the Manipal School of Pharma in terms of the curriculum? Could you help them design a better curriculum, a more useful curriculum, so that when the students and the graduates come out, that you actually have a better skilled and a work ready workforce? So, any thoughts on what kind of changes would be required at this point in time?
No, because we are going to have more and more people now. We are in the expansion mode, so we need qualified this professional, or I would say students. And if the gaps are limited, I mean, the way if the students are having a good knowledge of FDA and all the regulation, what you are talking about, I think it is very good actually. When we are recruiting this kind of people, I think, and the company is going for higher regulatory like US FDA and all and other markets, we need the talented people. And if from the beginning itself you have this in your curriculum or syllabus, I think it is always good. So we are also
industry academia partnership would definitely help in producing quality talent.
Yes.
Thank you very much for those thoughts, sir. I do have another question for you, but I will get back to you on that. But can I move on to Mr. Chawla and Chandru sir? Can you give us your thoughts and your opening statement?
Yeah, thank you. Thank you for having me here. So I think in the panel, probably I represent the oldest company in the country. Yeah, just a few days ago, we were 85 years old. And Cipla has the unique privilege of having born in the crucible of the freedom movement of the country. And this is perhaps the only factory, it was just a factory at that time, a small factory that Mahatma Gandhi ever visited. And as he was leaving the factory, he extracted a promise from the founder of the company, Dr. Hamid, that when India does become free, you have to promise that Cipla will help the country become self-sufficient in medicine, right? And it's on that promise that the values and the DNA of this company started growing. And there's a kind of a mission that runs across all 25,000 employees of the company, that what is the purpose of being in the business of life-saving medicines if they can't be accessible and affordable to everybody, right? So this is for 85 years we have been living this. And one of the shining moments of Cipla was in 2002, when it gave to the world its first cocktail pill for HIV patients. Those were the days where millions were dying in Africa and Asia from this disease. And the drug cost was $50 per day per patient, right, for a lifetime. And Cipla offered this to the world at $1 a day by standing in front of the European Parliament and announcing this, right? And that was I think a transformational moment, not just for Cipla, but the way the health world evolved after that. From being called a bandit or a Robin Hood of pharma, it became the darling of the pharma industry worldwide, and actually laid the foundation and seeds for the business model that exists today of a vertically integrated generic pharmaceutical company. Yeah, Cipla is one of the pioneers there. And almost every first of the country, the first factory to be approved by FDA, the first API to be approved, the first product to be approved outside of India, it's almost all Cipla. And it has been, since then, it's been a factory of leadership and technical talent for the rest of the industry. So I'm very proud to have been here for almost a decade and have spent my leadership time across various business functions. I led international business. I was head of corporate strategy, M&A, new ventures, and I'm helping build one important US pillar at the moment. And I have seen the industry go through multiple phases of its growth, right from where we were just an API supplier to the world to becoming now, I think we supply about 25% of the generic drugs used anywhere in the world by volume, not by value necessarily. And in the US, 1 out of every 3 generic pills finds its origins in India, right? So the relevance of the Indian pharma industry is not in the numbers of 50 billion and 100 billion. It's on the impact it has on the whole world in the way millions of people are able to access medicines which they were not able to
So
access.
how do you see India becoming #1 in this?
I don't think.
Let's talk a roadmap. Let's talk a roadmap. Give me 3 steps.
Yeah, so I think it's important to understand what we are facing right now. This game of #1 and #2 is not that important. I think we are talking about skills and capabilities. So let's understand what we are facing today. So the industry first is facing a simple fact: how do I keep everybody safe? Right? That's not only true for the pharma industry. That's true for everybody, right? And how do I achieve my business continuity in a way that is reflective of the new world, which is not going to go away anytime soon? So at least in my industry, we have realized what we are seeing today is not going to go away. Vaccine or no vaccine, it is going to stay, right? And we are calling this the NTSD world. What is NTSD? Non-touch, safe distance world. So NTSD has to become a mantra in everything that we do for eternity. It's not for 1 year or 2 years or 10 years or 20 years. This is eternity, NTSD, non-touch, safe distance. So everything that Suresh talked about that UL does and is now planning to do, it has to do it with this in mind, NTSD, right? So that's the reality. We have to look at our growth drivers differently. We had some traditional growth drivers, and this NTSD environment is now opening up some new opportunities. So we have to understand those. For example, you've seen an important event of the last week. I'm sure, I think the panel would have seen that. There was I think what I would call a cataclysmic moment, 2 cataclysmic moments. 2 e-commerce companies in the pharmacy space combined, they have merged, right? And at astronomical valuations. And Reliance Jio has bought a majority stake in a 3rd pharmacy e-commerce platform. I think those are clear indicators. And the other one, Amazon has been preparing a roadmap, it's got into it, it's announced formally, some back-end work has started happening. This is a clear indication, the winds of which were there, I think 4 or 5 years ago. If I tell you the valuations that I almost signed up for in some of these kinds of startups and to what they are today, it's a sea change. You are suddenly thinking you're in Silicon Valley. We are not in Silicon Valley, but the last few weeks, it appears that we have, entered a kind of a new era of health tech, med tech, biotech evolution. Right. So these incidents are now going to require a completely new thinking of the ecosystem, and they require new skill sets also to deal with the way we engage with customers and patients. Right. So that's another thing. The fourth one, maybe or third or fourth, I'll just give you 1, 2 other points, is that there's also this Damocles sword of the China conundrum that is hanging over the industry. It's a very difficult puzzle to solve, and all of us are looking at it very strategically. Everybody is acutely trying to conserve cash and diversify risk. So that those are important high-level strategies that are in place. And the last point that I want to leave, which we can discuss in the subsequent sections, everybody is looking to become green. Everybody wants a green industry. If nothing else that has happened as a result of this pandemic is the clear realization that you cannot continue with the way you were continuing in the past at the expense of the environment. Environment cannot be a cost to your business. It is now, it has to become a facilitator.
I think that is the biggest feature of coronavirus as well. If we were
exactly. So those are the few themes I would like to leave with the panel. And maybe we can discuss some of them in greater
I will
detail.
definitely get back to you on that. Thank you very much, sir, for those thoughts. Mr. Bhatt, I think you've also kind of had your sense of what your previous panelists have said. So quickly, you could give your opening statements as well on this. So you're on mute. You're on mute.
Okay. Now, can you hear me?
Yes.
First of all, thank you. Thanks for inviting this in this fantastic panel. And I really appreciate some of the views with Suresh and Chandru were sharing. And I really like what Chandru has been saying very passionately. And again, my other friend, Farhat also. Both came out very, very significant issues. And I'll go to in detail in a minute. But I work for Intas, which is today one of the fastest growing Indian company. We are very young compared to the senior people, compared to Cipla. However, if you look at Intas, it is one of the most vertically integrated company. We operate across 85 countries. We have around $2 billion business. And this is one of the company which is, unlike many other Indian companies, very strong in Europe, rather than, and has a good presence in US. And if you look at between Europe and US in terms of regulatory requirements, managing Europe in terms of different regulatory requirements is a little bit more complex than managing US. I'm not saying US is easy, but there's a difference. We are the only company who has got around 10 market authorizations of biosimilars in Europe. So from that point of view, the promoters of this company are very passionate. One of our director, Dr. Urmesh, is an oncology specialist. Mr. Binish Chudgar is the vice chairman, under whose leadership this both is happening, is very focused on how do you bring good quality products accessible to people across the globe. And,
so do you also share this belief that I think there's an echo at your end, but okay, do you also share this belief that the key here is to get good quality products for low prices? And if so, how do we actually reach that point? Is it because of the kind of new young people that are coming into the workforce? Any new innovations that we are looking at that you would suggest? I think Manipal here would actually get to learn a lot in terms of understanding how to build their curriculum as well for such an industry. You could just walk us around that.
See, first of all, I challenge the whole philosophy that products in India are not of that quality. If you look at the largest, last year, 38.84% of approvals of US FDA were Indian. You cannot have this kind of approvals if you didn't have the quality. And I forget Indian approvals. US FDA 38.4 were filed. India files close to 819 ANDAs. With that number, you cannot survive in the global economy with a less quality product, first and foremost. Right? So the whole philosophy which we have is the perception that Indian quality is not as good as the multinational quality is a big myth. When we say quality and when we look at cost, right, we'll have to, if you look in terms of basic parameters of any molecule, first you are trying to establish the safety, then you're looking at efficacy, and then you're looking at impact. Right. At different point of time, either you look at impurity profile or you look at equivalence. Now, what is the right amount of drug required at a particular point of site is at between 90 to 95%. Now, there's a possibility if you play with that range and if you are able to give good quality product properly in that particular pharmacopoeia, it's okay. So that whole branding that multinationals are the holy cows and they really have good quality, and then Indian companies, maybe they don't have quality standards because we don't have that mindset. To me is a very wrong mindset. And that is what I would possibly give you in terms of demonstration when you are asking the question, that if you look at Intas, some of the best oncology products, which are very expensive today, have been launched by
do you want to share your screen?
Later. Some of the best products which we have launched, oncology, which are accessible to in terms of breast cancer, ovarian cancer, many other places, have been launched by Intas, which are good quality at very affordable prices. So to your point, we can and we should continue enduring giving good quality products at an accessible price. Your second question has been continuously asking everybody that when will we be number one? Actually, if you look at it, 40% of our sales, 40% of the global supply today in terms of volume is happening from India. Now, if that is happening from India and it is Cipla and it is Sun Pharma, it is Intas or many other companies doing it together, right? But give me a single country which is providing 40% of the global supply in terms of volumes. Right. So from that point of view, if you look at it, today India is already sitting as a giant. The challenge which we have is we have dominated on formulations, but at a point of time, due to many other reasons, including the way the government policies were shaped at earlier point of time, we didn't focus on API. We didn't focus on the backward integration. And many of us, Indian pharma companies, we focus on vertical integration to the extent of we getting access to our own API for ourselves and not for the rest of it. And that's where the China scored up India.
And that's where they sort of taken the lead.
That's where they have taken the lead. Okay. Now, with the new government policy which has been announced, where there are incentives been given, many other companies are working towards it. I'm sure it's going to be a catch-up time, but certainly there's going to be a catch-up which is happening where possibly India would be able to have good number of APIs equivalent to what you have, the powerhouse you have in the formulations.
Fair enough.
Coming to, okay, now I'll pause in case you have any questions.
So I will definitely get back to you. I do have a lot of questions actually, but thank you for sharing that thought. And I think very diverse from what I've heard so far. I think what you're trying to essentially say is that there is no compromise on quality here. What we need to do is to develop enough APIs. I think I want to move on to Subrat sir. I want to move on to you. You've had a fair share and a fair sense of what everyone has said here. We've spoken about quality. We've spoken about quantity. We've spoken about that this is not a race. Where are we right now? Where do you, from an industry academia point of view, see the whole situation, and how do you suggest to your fellow panelists who represent industries very broadly here that India or how India could become the leader in pharma industry?
Right. A very good afternoon, Tanya, and to all the participants here. I'll not take time explaining what Manipal does. I guess the video sort of sufficed. On your point, see, there are two parts to this. There is a product market reform, and then there is the factor market reform. And we spoke about the product market reform in different ways and forms as the previous panelists just discussed, whether the quality of it, the fact that we got into formulations, not into API. And a lot of the product market reforms in some sense are actually, they are left to the industry to take some of those calls, and they can, of course, there are regulations which sometimes prohibit a certain kind of movement. But product market reforms are in some sense more manageable. The factor market reform, which is reform on land, labor, and capital, are more systemic, they're more structural, and that problem exists in India. And out of which I will pick the one that we understand, which is labor.
Right. That's a very important point, actually.
So now land is okay. I mean, we can do better with land, and capital, well, we will have to sort the fairly large banking system, challenge that we've had for the last 5 years. But leave that aside for a moment, and let's just focus on labor. And let's just focus on one aspect of labor. Of course, there are other challenges, but the one aspect on labor that I would like to focus on is the productivity of Indian labor. regardless of industry. Mark them in terms of you take sales productivity, you take manufacturing productivity, and you look at the structural reasons for the labor market or the labor force productivity in India. It boils down to a fundamental gap between what industry wants, industry's ability to predict where the future trends of skill requirements are, and the speed with which the Indian academia is able to manage and keep pace with that kind of dynamism. And this is a non sort of stop challenge in the last whatever 20-30 years that we have seen. The industry keeps demanding for newer skills, newer talent, and the university system, the education system, forget about keeping pace, actually sometimes recedes for various reasons. Faculty is poor, curriculum doesn't keep pace with what is needed. And this is the gap that needs to be filled if you were to really address the labor part of the factor market reform. And I believe that is a fairly significant element which will power some of the points that we have been talking about. I mean, without the labor market reform and without the labor force productivity issue dealt with, we will always trail global companies in terms of benchmarks and in terms of what we can do. Because no matter how well do you do on your product side, if the labor force productivity is not up to mark, you will have a benchmarking problem in terms of pricing or in terms of the way you are able to efficiently allocate capital within your enterprise. So, and that really is the one thing that Manipal has been doing across sectors in terms of addressing the challenge of labor force productivity at various levels within the organization.
Actually, then I think another very could be actually termed as a challenge as well, maybe for India to reach the scale that it needs to. But thank you very much for that thought. I want to move on to my next question, and Suresh, sir, I'm going to come back to you quickly. Can you tell me, are we infrastructurally ready? I mean, we've had this whole discussion. Everybody's pointed out their own fair share of problems or their own fair share of what they feel are in their strengths. But do you think, are we structurally ready to replace the APIs coming from China? And your thoughts on that?
So I probably may not be the best position to comment on that, because I'm not necessarily directly in the pharma industry. But what I could talk about, which if you want to take that as a separate point, which is just building on what Subrat was saying in terms of the skilling side of it, then the labor as a factor. And I think that there is a gap there, and infrastructurally there is a lot that needs to be done. And that's where I think we are heading towards. So I probably am going to refrain from commenting on the API side, because I probably would not be the right expert to comment on that.
Maybe then you can, okay, maybe one quick question from you that we could take up instead of that is, can you tell me what are the biggest challenges that graduates have been lacking? What are the biggest challenges that could be overcome now when we are actually talking about bridging the industry academia gap and sort of making future ready workforce? So challenges and expectations, basically.
Absolutely. So just building on, thank you for that, Tanya, because I think what Subrat's pointing out is a very, very important factor. And this is something that we're seeing not just in the pharma industry, we're seeing this across sectors in India, especially the moment you start thinking of manufacturing and I mean, technology products manufacturing is yet to take off in India. The talk about supply chain, but all of that needs to happen, yes. And yet talent is a very, very important element which is several times under noticed, and I think that's what we are starting to put focus on, and saying that talent development is critical. If we just stay with the pharma industry, and clearly there are people here who know pharma industry far better than I would ever know, and yet I think it is a globally competitive industry. There are increasing pressures on regulatory compliance, no matter, I mean, every market you look at, I mean, not just US, Europe, I mean, every market is looking to up the ante in terms of regulatory compliance and how strict they are. and so on. So I think in that kind of strategic context that this industry is operating in, I think to me, what it will require to comply to a US FDA regulation versus a MHRA for the UK, etc., might be slightly different. And yet, I think when you look at all of that from a need perspective and what is coming from a supply perspective, from a academia or sort of schools which are graduating, there are fundamental skilling gaps, and clearly people here, Chandru, Ajay, and Farhat, I mean, they're really looking at graduates from universities or colleges, and also sort of cross pollination of talent from others. I'm sure that they are noticing some of these gaps. So the gaps, as I put it, there are probably 3 different styles of thinking in what those gaps might be. The first one is just the core gap, which is the core skills on manufacturing, on quality, on using technology, on using, I mean, just the basic, which are skills which can be trained, and which is what I think the School of Pharma will primarily focus on. This is just basic skills that we expect the talent to have when they walk in to work for a Cipla, for example, fresh out of their degree or college. And those are core skills. I think in addition to that, there is a second stream of skills, which is, you could part coach this, but some of this is inherent, which requires like critical thinking, creativity, communication, ability to collaborate. Some of this can be coached. And
ability to innovate as well. I think that is one of the most important skills. I will get back to you, Suresh. A couple of more things that we do have to cover, but thank you for laying that context as well. Again, I want to move on to you, Chandru sir, and of course, you would be the right person to obviously talk about the question that I had previously put to your fellow panelists. Tell me, do we have the sufficient capacity? Are we infrastructurally ready to replace the APIs coming in from China? Is that what's blocking us to be number one? Although I know you believe that this is not a race, but where can we be the best and do the best out of our capability?
Yeah, so this has to be looked at in maybe 1 or 2 different ways. Let's leave China may not be the right definition of this problem, right?
Okay.
Because remember, as responsible companies and industries, our first job is to see ourselves being long-term sustainable, and long-term sustainability is dependent first on cost competitiveness, right? And continuity of supply. So yes, everybody is concerned with continuity of supply, but there are 2 or 3 sort of forces that are currently playing. So one is, remember, we are fresh from an era of the last 20 years, which was a very strong wave of globalization. What did globalization mean essentially from a structural point of view? It meant global, single source, global sink. It means you have centers of excellence, large global centers of excellence, doing 1 product, 2 products really well with high levels of competency and supplying to the globe, right?
Right.
Now with the winds of nationalism sweeping all across the world, practically every country is telling you this, that look, boss, this doesn't work. We are all concerned with our own supply security, and therefore you have to adapt, right? So we are moving, or we are trying to move away from that structure to a structure which will be perhaps more multifaceted manufacturing spread across the world and with very less centers of excellence, right?
Right.
Or you may have centers of excellence that may need to be extremely flexible, agile, and mobile, right? And mobility, of course, is keeping in mind, you know, the COVID era that we are in, whatever mobility means at this point of time.
Yeah.
Right? So this would therefore mean that, you know, the way our sort of manufacturing footprint is likely to evolve, and it's not going to happen overnight. It's going to be a reasonable journey. That's going to be very different. Instead of being a single hub and multiple spokes, we may have sort of multiple hubs and no spokes at all. That type of
so that kind of an evolution also could take place,
kind of
which would put us
out,
in a pedestal to sort of be
that
a
type
leader
of spread out, decentralized manufacturing. And when it comes to China, please remember, we are saying that we want to make everything here in India, whether it's an in-house or in some other Indian factory. One has to understand that any API is dependent on multiple things. Yeah, you probably need, depending on the API, you may need 10 things or 50 things to make it. And you can't really go all the way back to making sulfuric acid in India. So when a person is talking about backward integration, you have to talk about it with some realism, right? To what level are you going to backward integrate? And of course, if you want to really backward integrate, we should be, we should be synthesizing oil in this country because everything flows back to there, right? So one has to be very realistic over here, and one has to understand that if you're going to put focus of your capital on going back in the value chain, you may have less capital to spend on going forward in the value chain, right? So business models are always keeping in mind that your presence across the value chain keeps improving so that your margins improve, your returns on capital improve, right? As you go backward, by the law of nature, it is going to reduce, right? So you have to do this in a manner in a
very realistic manner.
Not a realistic manner, in a manner in which you can still be sustainable. That means your cost factors still have to be working in your favor, right? So the question is not, can you de-risk from China? The question is, can you de-risk in a way that you are cost competitive on a sustainable basis?
Absolutely. I think a very important point you've shared there, cost competitive. Absolutely. Thank you. Thank you very much for your thoughts. Can I move on to Mr. Farhat and have your thoughts here? I think Mr. Chandru has left on a very good note for this question. I think you might want to pick up from there and sort of build your answer.
No, actually, I could observe in last 5.5 months, the Indian pharma market has come out from these challenges compared to any other countries, including the Western countries and US also. If you ask, anybody is not having a shortages of medicine, whether the people are on lifelong treatment or something, the e-commerce and the products are available freely and the companies are manufacturing. But one difference is there. Now only proactive leaders will be there in the market, and fortunately Indian market has more leaders in the form of many companies who are present here, and many more companies are there. So they could come out from this pandemic in a different kind of manner, and that has given a new direction to Indian pharma industry, that in future we are going to have a big players. But they will be proactive leaders, and with respect to the API shortages, and we are dependent on China. I think government is very proactive now, and they are also offering a lot of incentives and increments for the companies who are interested in API. So I think the avenues are there and opportunities are lined up, and very soon I think this problem will be over, and I think our growth will be there. Nobody can stop Indian pharma industry. The second thing which I could observe in last 5.5 months, that I could see there's no gap with respect to the pharmacy college and other colleges like yours, that they are online or something.
There is no gap. There is no skill gap.
Yeah, skill gap.
Really? That's a very interesting perspective somebody has shared. Actually, you should build on that. Why you told that there is no skill gap?
Yes, because I could see the lot of orientation programs happening. People are joining, and even on the virtual, but the continuity is there. It is not only that business continuity should be there. I could see that academic continuity is there. It's a good signal of knowledge age. When the institutions are ready to face the challenge, it has happened first time in this world. When the universities like Cambridge and Harvard, they are totally empty. Their classrooms are empty. But I could see the pharmacist college and all this, they are engaged, and the students are enrolling, and I'm getting a lot of information. All the orientation is going on, the business is on. These are the good signals for, especially for pharma industry, because if we have this talents available in the market in the form of students coming out from the pharmacy college, at the same time we have big players and have a very good direction in terms of leadership, and the government is also working on the same line. I think future is there. I don't see any issue as for the pharma industry is concerned, and India is going to become a major player.
Absolutely. Thank you very much for leaving us on that positive thought. Can I move on to Mr. Bhatt? And sir, can I have your thoughts here? Do you agree that there is no skill gap? Because that's something which is actually a very important takeaway here. We are actually debating that for a very long time.
So Chandru left us with a very good message, and I think Farhat also is giving a very good dimension, saying there is no skill gap. And I understand the context in which both of these gentlemen are coming from. Right? Let me first step back, and from my perspective, if you don't mind, can I share something which I just made it for this particular audience? So there's a slide which I would just like to put up, if you don't mind.
Just give me a second.
Sure. So while we
I'm making you the co-host. Yeah, you can share it now.
Okay.
And Tanya, I have a comment to what Subrat said. So maybe after Ajay is finished, I'll come in.
Sure.
While he's fixing his technical things that is in, you can quickly drop in the comments.
Yeah, so I think Subrat made a very important comment on the gap in productivity between what is available and what the industry expects, right? And I think there is a context over there which is important to learn. You know, when in our sort of age when the industry really picked up and started getting deep into markets like the US, etc. Our primary competition were companies that didn't have their roots in India, right? So we were also blessed with a cost arbitrage that we were enjoying. Now, if you see the most of the competition that Indian industry faces, let's say in places like the US, you're really competing with the same set of peers, all of which have now roots in India. So the cost arbitrage between this same rat pack is no longer there, right? And therefore, there's a sort of an inhuman and a monumental Himalayan need for being able to do much more with less, across sort of entire gamut of your operations, right from the shop floor to the labs, into the research and development units, the way products are developed. So the productivity demands now are arising out of a different context, right? Because we are competing with the same set of people who also enjoy the same arbitrage. So I'll leave that as a thought, and maybe Ajay can come in with his views.
Thank you very much.
Can you see this?
Yes, we can.
All right. Is it full screen now? All right.
Yes, it is.
So I think we are doing a very good discussion. If you really look at pre-COVID and the post-COVID scenario, okay, some of the things which we are speaking in terms of the focus on quality, the need to ensure your margins are tight, your productivity is good, industry competing among itself as far as the global supply is concerned. And then we had COVID, where the whole thing changed in terms of how do you still continue developing and producing and supplying those products in a supply chain or in a very fragmented manner. And the last 3-4 months has taught us many of us a lot of things. And I agree with my colleagues that possibly one of the industry, apart from the essential services which were taking care of people, the only industry which possibly did very well and stood up was the pharma industry, because there has not been a single day of lockdown for many of the pharmaceutical industry companies. Companies kept their manufacturing on with around 10 to 15% of workmen, so to see that the essential products are supplied. Now, if you look at in all this, there are some trends which are impacting pharma industry, and one of the trend which all of you, I think you started off, is that the need to increase the API capacity and capability for the organ. Correct? That's needed. And I think
also sustainability plays a very important role. I think that might take away from Mr. Chandru's thought here.
Correct. So in the context of and the Chandru said keep China away, because there is a dimension of sustainability in how you manufacture API at what cost is what he was trying to allude to. So that's included. The time to market new products is getting shrinking. You don't have, now look at the COVID, for example. The whole world is anxious. People are trying anything. Tocilizumab, correct? That was the golden drug which was claimed to be the first line therapy for COVID. Now the original company is saying that no, it's not effective. And people are waiting for a new vaccine to come in place. So this kind of situations will continue to compress the pharma industry to come out with new molecules, new treatment, and new way of getting solutions in a much shorter time frame. And when you look at shorter time frame, again, we have to go through all those requirements of safety, compliance, effectiveness, which are regulatory requirements. You can't just hook something in a beaker and then give it to people and say, here you have. I know there are some countries which are still doing that, but that's what is required. The government policy is changing, not only in India, but the kind of regulatory enforcements happening in Europe, US, even the smaller countries like Lebanon is now asking of a particular standard and particular method, which possibly was unheard of. Correct? So on terms of some of the parameters of quality, the world is becoming equal. Everybody wants good quality. Everybody wants good quality at affordable prices. Now the whole mindset that you need, if you have to have good quality, you have to pay a price, is broken.
Yeah.
And these are the things which are playing on the manufacturing R&D in terms of what are the new techniques which are required. If you look at supply chain, the last 3, 4, 5, 6 months has taught the supply chain people a lot of things. And one, instead of having center of excellence, how do you create a hive of, so in my last earlier organization, Chandru, to your point, we broke the whole concept of center of excellence in terms of global R&D centers. I was working then with Abbott, looking after the global R&D development, HR. And if we had to compress our product development time and make it cost effective, the way it was happening there was to make a one component at one place, characterize in one place, and then move it to the next place where the other team is very effective, rather than each team trying to do the same thing, and use the hive very effectively rather than keeping a center of excellence. So those models are already coming in place. In my current organization, we are using the hive models for some of our biosimilar kind of activity. And the most important, I think, if you look at marketing, the time to market, the time availability, right from a doctor to the patient, the way the doctor patient is now interacting, the way we are going to market, the kind of supply chain integration which is happening, everything is are the different mega trends which are impacting the pharma industry. So when we talk about how and when we are going to become one, we need to recognize that the game has changed, and pharma industry has to keep on taking this along with its skill building program to adapt for this. Otherwise, what will happen? We'll try to keep on adapting, and the goalpost has already changed. So to that point, if I look at again the emerging skills which are required, and from a technical and behavioral point of view, if you look at manufacturing, R&D, largely, there's a whole set of how do we create the new skill set of scientists who are more into discovery-based science, gene sciences, CAR-T, and that, rather than be formulators who are in generic medicine. Indian pharma company has done fantastic in generic formulation. But moment we start doing complex and value-added and NDDS and transfer and technology, then possibly we do not have that kind of skill set. And it's a matter of evolution, but India pharma industry will have to evolve that as a faster. So if education institute can do something about it, I think that's where the focus is. A lot of education institutes have gone into the pharmacy college, churning out talents which are good as formulator in a generic industry, which is good. A, B, not only the industry, not only the colleges, but the industry also will have to support and start partnering.
Absolutely. Thank you very much for those thoughts, sir. I do have a limited time here.
No, I understand. The second area is the big data analytics and the MI. So that part I'm not getting into, but these are the areas which we will have to look at. And I understand you don't have time, so I'll take it off, and that's okay. Thank you.
But thank you very much. I mean, for the kind of presentation that you've gotten here in this discussion as well. You might want to stop sharing your screen now. I think we highly appreciate this. I want to move on to you, Subrat sir, and you've also sort of heard everyone's perspective here. So your thoughts on this?
Right. So a couple of points. I think the first point, which Farhad mentioned, around the skill gap. I think his point was around the disruption in the HR supply chain during the pandemic, which has not happened, which is true, and which is a credit to all the HR teams in various companies and how they have managed to sort of transition in this time to virtual inductions and virtual onboarding programs and things of that kind. I think the skill gap or the gap that is there is in the quality of the HR supply chain, not so much in just the flow of people, and that has not been impacted as much. But the quality challenge remains, which even Mr. Bhatt, while mentioning that we need to go forward in terms of integrating and getting into higher value added work. How will that happen unless you have good quality research in India, which is done for by Indians in India, and therefore then becomes the sort of the supply to India of pharma companies in terms of their ability to go forward in the value chain. So again, that brings us back to the challenge of having a gap between what the industry demands and what the academia could deliver. So that's one point. The second point is on this, the API, China, we should do everything on our own now, and so on and so forth. See, the comparative advantage is a subtle concept, right? Trying to do everything, even if you are good at it, it has been proven by Ricardo. People have won Nobel Prize for it. That doesn't work. And we need to understand what is our comparative advantage in the various parts of pharma supply chain, which I think we have understood very well, and we have done quite well with that. The disruption in the global supply chain because of the pandemic and a certain amount of belief that you can't have all your eggs in a single basket, which is the China basket. And therefore, we need to trade off between redundancy and cost, or as they say, move from just in time to just in case.
Right.
All of those represent an opportunity, but that opportunity has to be dissected, and we need to be clear about what are the specifics within that opportunity that represent an advantage for us, which we need to go out and do. Otherwise, like Chandru said, we will start manufacturing sulfuric acid, which is not the most productive use of either our capital or our labor.
Or your time,
And therefore,
exactly.
yeah, and therefore that has to be sort of, it's a more nuanced argument, and somewhat more calmer minds need to think about the
And
notion
better
of
strategies
competitive
and more effective strategies need to come into play at this
yeah,
point in time as well.
yeah.
Anything else you'd like to add, Subrat sir, before I move on to the closing remarks from Mr. Sanjeev?
I think there was a point at the end of Mr. Bhatt's presentation on big data. And that actually is, again, a fairly important element. I mean, that's something that we can be good at. We, can be a global sort of provider for data science and, artificial intelligence kind of capabilities that a lot of our folks are learning today. And, pharma clearly is a fairly large opportunity in that space, uh, has a large opportunity in that space. And the data sets, the way you need to sort of standardize the data across multiple industries and multiple countries and regulations, and then be able to train a whole lot of people here who then become a talent pool for the world to use, is an opportunity for sure in this space.
Absolutely. Thank you very much for sharing those thoughts. And once again, Mr. Sanjeev, I would like to call you on board to give your closing remarks and sort of a summary of what you have gotten from this discussion.
Thank you. I would like to firstly thank all the panelists for taking out their valuable time for spending with us and sharing their thoughts on the future of skilling. I think some of the very, very brilliant and key points that I could take away personally was, these cost competitiveness in a competitive scenario, and how do you really make this on a sustainable basis. And I think that was very well brought out by Mr. Chandru. The other bit that I really appreciate is about the non-touch safe distance, and yes, that is going to be now a new reality going forward. And this entire the points that Suresh spoke about in terms of the three levels, which is the core skills that every person needs to possess, and the second layer being the some of the softer skills in terms of critical thinking, innovation, and so on. He was just talking about the third point when I think you ran out of time. So we will catch up separately on that, Suresh. And then, of course, there is a lot of the good points made by Mr. Ajay in terms of the API, increase in capacity and capability for India versus China, and the wonderful slides that he shared, and the movement that he spoke about from generic-based knowledge, which is currently there, to moving into more biologics-based and more core areas. And then he touched upon data analytics and market intelligence as being some of the core skill gaps that are currently there, and which Subrat really spoke about when he said that India has the ability to really become the world knowledge center, so to speak, in building this capability around data analytics and big data. I think one of the finer points that Subrat made about the factor market reforms, especially around labor, really touched a deep chord because that's where really the entire skill gap is. And unless we solve for the labor skill gap, so to speak, or the labor the skilling initiatives, be it faculty, be it curriculum, be it the students themselves, I think that is really going to be the challenge moving forward. And I really see a large role that organizations like Manipal, ProLearn School of Pharma can play in that area, along with some of the pharma companies and with knowledge-based partners like UL. And of course, then we had some wonderful points by Farhat in terms of the fact that while there was no disruption during COVID, in terms of the flow of talent, and then Subrat built on that to say that it's more about not the skill gap in terms of the flow, but the real skill gap today in pharma is really about the quality of people and not so much about the flow of talent. There is enough flow of people looking out for jobs, and I think that, of course, the pharma industry has been able to manage even during COVID. So I think really looking at what critical role that organization like Manipal ProLearn can do with the School of Pharma is really to bridge some of these quality parameters. Also, I remember early in the conversation, Suresh spoke about quality being one of the critical parameters around, and one of the critical areas that we will need to differentiate as and for the pharma sector in terms of skilling the overall graduates moving out of the pharma industry. So thank you so much. If do we have the results of the poll?
Yes, yes, we do. I've already sent them to you.
Okay, brilliant. Yes, I have them. Oh, this is really good. Very, very encouraging. So we have almost 100% response to the first question. Would you like to be a part of more such sessions? And brilliantly, almost 100% have said yes. Are you looking at training and upskilling your pharma workforce? Almost 60% are saying yes, and we would want Manipal ProLearn to build on that. And would you like to learn more about Manipal ProLearn School of Pharma? 73% have said yes. Please send me your details. So brilliant. I think the poll results are
Very
phenomenal
encouraging
and
response.
very encouraging, and that shows the participants, all 85 of them, are really enthused about what the panelists have shared today. Once again, a large thank you to all the participants who have made their time and the inclination to be here and send in their questions and be part of the poll. And of course, a very, very large, warm thank you to to the panelists here who have contributed so much to the panel discussion today. Thank you once again.
Thank you very much.
Thank you, Sanjeev. And I would also like to extend a warm thank you to all the attendees as well who have been sitting in patiently listening and putting in their thoughts and comments on various streaming platforms and on Zoom. Thank you. You guys actually made it a success. And a big thank you to all my panelists as well who took out the time and energy to actually come here and discuss their expertise and actually help us in understanding where India is going and to what direction and where do we see the future of pharmaceutical industries as well. Very interesting answers from all of you guys. And Mr. Bhatt, I think the small presentation thing that you came up with, that was very encouraging to see that you took that kind of effort to sort of divulge as much information and knowledge as you could. So kudos and a big thank you for that as well. Personally, from the team of Observe Now and on behalf of Manipal ProLearn School of Pharma, I would like to thank all of you. If you wish to check out the recording of this entire session, it is available on our Facebook page. So Observe Now's Facebook page, it's right there. If you want to share it, if you want to review it, anything, it's right there. If you need the raw file, you can let me know. And so it's a Friday, it's already 5:30. I'm sure you all are excited about your plans of cooking because that's on a Friday these days. So good luck. I hope you make some really good food tonight and stay home, stay safe. And we will see you soon since all of you want to see us very soon. So thank you, Manipal, School of Pharma, and thank you to all my panelists. Have a
Thank
nice
you,
day.
Observe.
Thank you. All the best and stay safe. Thank you.
Yeah. Cheers all. Bye.
Thanks.